So how we lift things is really, really important. And actually it's probably more important than the weight of the thing we're lifting. So we need to change our advice to patients, and instead of telling them not to lift things, we need to show them how to lift things. So if we've already worked on our breathing mechanics and we've established some connection with our lower abdominals, we've learned how to create that little bit of bracing and tension in those lower abdominals, then people can then lift things safely. So our breathing mechanics and practice is step one, and then people can lift things in a safe way. So let's take, for example, a classic thing that people are going to want to lift post-surgery, and that's just picking up a kettle off a worktop. So here we have a kettle. We're going to stand close to the worktop, and we want to think about creating that bracing of the lower abdominals. So we want to stand nice and tall, so we've got a nice stacked position. We're not bent over like this. We want to make sure our posture is nice and tall. Bring the item that you want to lift closer to the edge of the worktop. So we need to be thinking about everything that we're going to do, thinking about moving in a smart way and lifting things sensibly and carefully rather than just doing it mindlessly. So set ourselves up for success. Standing close, nice posture, create some engagement of those lower abdominals, so a little bit of a brace. Now we don't hold our breath, make sure that we've exhaled and we've got this connection. Bring the item close to us. You can put a hand on the worktop if this is in the case of a kettle. We take a breath in and then we exhale as we lift the item and then pop it back down. So that connection of the lower abdominals is the key part of how people can lift safely. We've created almost our little internal support belt, and we are managing our intra-abdominal pressure to enable us to lift something more carefully, more safely. The exhale is really key. So we always want to think about exhaling whenever there's any effort or exertion involved in anything, whether that's a lift, a push, or a pull. So that ability to engage the abdominals and exhale when we're doing the lift or the push or the pull are some simple key tips that you can give to your patients to really help them to get back to those activities of daily living and back to normal life.